Hi, I'm Melissa Cady, and I'm the owner of Painless Wellness, and I'm a board-certified anesthesiologist and board-certified pain medicine physician. And I wanted to give you an idea of what to expect on the day of a tummy tuck or an abdominoplasty, whether I'm the one who's your anesthesia provider or any other trusted colleague that I've assigned to you. And what will happen is the surgery center will call you the day before or Friday before a Monday if you have a Monday procedure to let you know what time to show up, usually 1 hour to 1.5 hours ahead of the scheduled surgery time. If you're in the afternoon, just remember you might get moved up, so change your guidelines accordingly as far as don't eat for 8 hours for sure. I'd prefer you not have any food the day of surgery, and if you are later in the day, then an ensure clear drink, something that is got no fat and no cream and no pulp or any solid pieces in it, can be utilized up till 2 hours before the surgery time. Maybe do 3 hours before if you're in the afternoon in case you get moved up a little bit. If you want to have a little extra hydration, which is encouraged, so make sure no solid food for 8 hours, and up to 2 hours before, maybe 3 hours in case you might be moved up. You can have clear liquids or a clear Ensure. If you're really stuck on caffeine, watch that caffeine video. Essentially, you can have a tiny bit of maybe black coffee or something, but not your full dose, just to make sure you don't get dehydrated, to make it easier for an IV and also to remain hydrated for the surgery, even though we'll be giving you some IV fluids. So when you arrive, they'll bring you into the pre-op area in a bay behind a curtain. They'll go ahead and have you change out of your clothes into a gown. They'll check your blood pressure, heart rate, and everything, verify the consent forms, and start a small IV, usually in the arm, on very rare occasion other areas depending on the type of surgery. Once all that's been done, of course, the surgeon will come by and say hi, and I will say hi, or whoever your anesthesia provider will come say hi. In addition, there'll be a circulating nurse, be coming from the room, who'll be with you throughout the procedure as well. We'll all verify similar questions many times just to make sure everything's accurate and consistent. Once we're ready to go, a little relaxing medicine either from the nurse or the anesthesia provider will help you relax on the way to the operating room, many times not remembering getting there when you look back on it. But once you're in the room, we'll give you a little bit of oxygen, get all the monitors on, and then through the IV is how you get fully asleep. It's a very gentle, quick way to fall asleep with the IV already in place. And then once you're asleep, depending once you're asleep, then a small breathing tube is placed through the mouth between the vocal cords to ensure your safety, especially when we relax you a little bit for the tummy tuck procedure itself. The other thing around the time that a breathing tube is placed is a catheter to the bladder is typically placed in the most standard tummy tucks to make sure your bladder is flattened, and especially if there's additional procedures that lengthen the time of the procedure, we want to make sure we can keep an eye on your fluid status and not let your bladder be too distended and not be able to relieve itself. When you're asleep, of course, during this procedure, the surgeon places lots of numbing medicine along the abdominal wall to make sure that you're nice and numb. If you have other areas covered, all of that spread out in all the areas so that you're nice and numb and that there's not a lot of need for high doses of long-acting opioid medication. So that helps you out as far as minimizing the decrease in the risk of nausea. However, speaking of nausea, 3 or 4 different anti-nausea medicines are given to help prevent nausea. Most anesthesia providers out there will give 1 or 2. If you get the standard 2, it helps about 95% of people. However, my practice in general, I've seen that if 3 or 4 different ones are given, 99% of patients do just fine in most circumstances. Whenever surgery is done, the anesthesia that you're breathing through that tube will just be stopped. You'll start, within 10 to 30 minutes, wake up. Most people are in the recovery room anywhere from 1 hour to 2 hours. When it comes to tummy tucks, many times, even though the catheter to your bladder is removed before we go to recovery room, the surgeon may want you to be able to void on your own without any difficulty to verify that. So that will be done prior to your discharge. So that's one of the requirements typically. Sometimes that can be altered depending on different circumstances. Your person who will be picking you up or whoever gets updates will find out after we get started with surgery that we're underway every 2 to 3 hours, depending on the length of the procedure. And then, of course, from the surgeon, and then the nurse in recovery room will give a heads up when you're close to that last hour or last 30 minutes being ready to go, so that they can join you, get discharge instructions, etc. If you have any particular concerns or questions based on this video, please make sure to write them down and address them with your anesthesia provider during the anesthesia consult. We'll be happy to answer them for you.